go on and resect the remnants of the ethmoidal bulla. Carefully doing so. See, this is the so-called bulla lamella, which swings up to reach the skull base, and in the vicinity of which we said we probably will find the anterior ethmoidal artery. And there we are. We have seen it already via the in the lateral sinus. There we have the anterior ethmoidal artery swinging across. We'll carefully nibble these structures away, and there you see the bony canal. Let's go back again to make sure where we are. We have our middle turbinate. Still, it has not been touched. We have opened the so-called lateral sinus now above the bulla, and we clearly can see the so-called ground lamella now. This is the posterior part of the middle meatus, and its roof is the ground lamella, and here it swings up to become integrated into the ethmoid. Let me take away these final remnants of the bulla to outline this ground lamella a little bit better. So there we are. You see, this is not a straight or horizontal plate, but it can have many curves and bulgings depending on the relation of anterior and posterior ethmoidal cells. So if you have to go on to the posterior ethmoid, we should not go on here or even up there. This will lead us straight to the skull base. We should go immediately above that corner where the horizontal course swings up into the more vertical course. So I will go right through here to penetrate very carefully into the posterior ethmoid. Means first, of course, you go into the superior meatus, and then you open posterior ethmoidal cells. So I just make clear, and that's what I would do during surgery, insert the blunt instrument, and then, like preparating, I would spread that open, first have a look, is there a lumen? Yes, there is, and then go on and take the bone away if there is disease. Now we can resect this, as we have identified the lumen, and there's no problem in creating a relative large connection to the posterior ethmoid. And that's what I'm doing now. It will take me a few moments. This is medial. That's where our middle turbinate is. Okay. So we should not take the entire ground lamella down, because this supports the middle turbinate, and otherwise it might fall off. So let's have a look, and we're apparently looking in a huge, almost singular posterior ethmoidal cell. And remember what we said about this triangularly shaped cell, these onody cells pointing away from you. Remember, we're on the right side, though this is lateral over here, and there we have the apex of the orbit. And if I penetrate here on purpose, which easily is achieved, I will be able to penetrate into the optic nerve. Remember that. I will fold it back, and we come back to that a little bit later. Can I have that spoon, that delicate small spoon? So if we're looking now for the, I will remove the mucosa, which is something you will not do in a real patient. This is only done for demonstration purposes to show you better the structures of the ethmoid. Okay. Can I have the spoon? So, first of all, I must say, of course, we don't know what kind of a posterior ethmoid our patient has and whether he has a sphenoid sinus at all. Only the scan or the X-ray would have told us. So, once again, that's our perforation in the papyriceous lamina at the apex of the orbit. This is onody cell, so never go on in that direction where you believe the posterior, the sphenoid would be. So, if we have to look for the sphenoid, we should do so as much medially and inferiorly as possible. Here we can already see a cell shining through. I cannot tell you for sure whether this is another posterior ethmoid cell or already the sphenoid. I believe it is the sphenoid, because here I can see the posterior ethmoidal vessels swing across. Here's the small one, there's the bigger one. So let's try to press this structure in by going medially and inferiorly. So we open that. And I think I will need the aspirator because that unfortunately still is filled with ice. Once again, that's a deep, fresh frozen head. So this is full of ice. I will try to have a chance to get that around. And maybe you can see the angulation. We do not go up here, but we have swung down a little bit to reach for the sphenoid. Let me see whether this ice will make it. Well, it does, but it's somewhat tricky. Can I have the straightforward Blakesley again? No, hot water would take too long. So I'm going in with the Blakesley and try to remove the ice. Yes, there we go. You can see the crystalline structures of that. What I do now, I widen that a little bit more. Take off the mucosa, maybe it doesn't bite anymore. You have to clean it in between the branches so it can close again. Okay. And I already can nicely see the optic nerve, which I will demonstrate very soon. But let me first finish that cleaning procedure. Can I have the spoon again? Well, and I believe it's difficult to tell now, are we in the sphenoid already or not? I believe yes. So there is some ice inferiorly. Well, let's see. Well, let's go back for orientation. Middle turbinate, insertion of the turbinate. All the way up, anterior ethmoidal, roof of the ethmoid, posterior ethmoidal vessels. And there now we have our friend, the optic nerve. Can see it clearly bulge in the lateral superior aspect of the sphenoid sinus. Remember once again, this was this triangularly shaped cell which pointed away from it. So I told you don't go in that direction because this will be the ideal place to kill the optic nerve. And this is true. Remember or imagine you would have gone on here, we would have hit directly the optic nerve. This is the optic nerve. I hope that is somewhat clear. Okay, let's get in again. Yeah, once again, the monitor quality I have is not too good. If it's over there, that's okay. So I hope you can see that optic nerve very clearly outlined during its entire course over here. And inferior to the optic, I think this is an excellent situation to demonstrate that. You have the bulging of the carotid artery. And you can even see that this bulging is a little bit reddish or bluish. And this is always an indication that there is almost no bone above that situation. So look at the size of the spoon, and I will try to take away or feel whether there is bone or not. And look what it does without any effort. There is a bone.